7 Side effects of rose hip during pregnancy. Once you are pregnant, your body changes, both from the inside and the outside. While your doctor may suggest measures to take, there are others who love to tell you what to eat and what not to, during pregnancy. Prominently figuring in such advice is 1 Herb rose hip. You are unsure, and possibly even suspicious, about rose hip. But don't worry. Here, MomJunction has put together some relevant information about the use of the herb rose hips during pregnancy. What is rose hip? Rose hip is the fruit that appears on the rose plant. It is usually red or orange, but it can also, sometimes, be dark or purple. Rose hip is also known as rose hep or rose ha. It is categorized as a wild fruit and is endemic to parts of Africa, Asia, and Europe. Rose hip is rich in vitamin, antioxidant, and mineral content. Is it safe to have rose hips during pregnancy? There are no research studies that have been able to determine the effects of rose hip on pregnant women. As a result, most medical practitioners will advise you to stay away from using rose hip when you are pregnant. Side effects of having rose hip during pregnancy. Whether or not you are pregnant, you can experience side effects of rose hip. In severe cases, it could also require immediate medical attention. Here are some of the more commonly known side effects of taking rose hip. Pain in the stomach, diarrhea, headache, nausea and vomiting, difficulty in falling and staying asleep, fatigue and excessive feeling of tiredness, heartburn and acidity. When you should avoid taking rose hip. If you are aware of any of the following health conditions that you suffer from, you should not take rose hip, unless your doctor has advised you OTH. Otherwise, if you are suffering from sickle cell disease, the vitamin C in rose hip can turn the blood more acidic and worsen the situation. In case you have glucose 6-phosphate dehydrogenase deficiency, the vitamin content in rose hip can increase your chances of a complication. If you are suffering from hemochromatosis, if you are suffering from thalassemia, if you have been diagnosed with sideroblastic anemia, if you are suffering from kidney stones, the vitamin C content in rose hip can further increase your risk of having kidney stones. In case you take the Coumadin, warfarin, medicine, make sure you do not take rose hip through the duration of the medicine's course. As rose hip contains a large amount of vitamin C, it can interfere with the medication and cause an adverse reaction.